Hello, everyone, and welcome to our Softfeel Academy webinar. I am Hannah Tebeka Azriel, and I will be the moderator for our webinar tonight. Tonight, we will talk to you about lips, and you will know everything about the perfect lip injection techniques, when to use cannula, when to use a needle. And for this, we have tonight two amazing speakers, Dr. Ricky Smith from South Africa and Dr. Natalia Pavlovic. Thank you so much for being with us tonight. Thank you to the two of you.
Thank you.
I will begin by introducing a little bit our two speakers. I'm sure you're already familiar with them, but quickly, I wanted to tell you more about them. So Dr. Ricky Smith has a private practice in Pretoria in South Africa. Besides her practice, she also holds the positions of senior faculty member of the American Academy of Aesthetic Medicine, training doctors in various continents. She's also the founder of the Aesthetic and Anti-Aging Medicine Society in South Africa. She's the scientific chairperson of the Aesthetic Medicine Congress of South Africa. She also developed a course in aesthetic medicine in South Africa. Additional to that, she is a global KOL for various aesthetic pharmaceutical companies in the industry. She's an international trainer and author of medical articles, journals, and publications. And now a little bit more about Dr. Natalia Pavlovic, who is aesthetic physician in Croatia. So Dr. Pavlovic, Dr. Pavlovic is, she graduated from the medical faculty of the University of Zagreb, and currently she is pursuing her PhD, specializing in nutrition. She has been dedicated to the practice of aesthetic and anti-aging medicine for the past 10 years, and she has furthered her expertise in non-invasive aesthetic medicine through professional training programs conducted in Milan, Geneva, Monte Carlo, London, and Croatia. She's an active member of several professional associations. Dr. Pavlovic's commitment to continuous education and her membership in medical societies underscores her dedication in delivering high-quality care to her patients. I will tell you a bit more about now how our webinar is going to go. So it's going to last approximately 1 hour. We will start with both presentations, and please don't hesitate to ask any questions in the chat or in the Q&A, and we will answer all of the questions at the end of the webinar. Hopefully we can answer everything. Also, I wanted to precise that this webinar is being recorded, so if you're missing any parts, it will be available from tomorrow on Softfeel Academy's website, and the replay will be also subtitled in French and in Spanish. So let's go now. I guess that we can start, and we'll start with Dr. Ricky Smith's presentation. Thank you so much.
Thank you very much, Hannah, and thank you for this opportunity. I think tonight is a very interesting topic that we always talk about lip injections, and is it really possible to have good results with a cannula? And we'll have two opinions, and I'll give a little bit of where I like cannula and where I don't like cannula and why I prefer to use it. And then Dr. Natalia will also share her opinion with a wonderful presentation. Okay, so why do I like cannulas for lips? So I'm going to basically explain it in different aspects. First of all, vascular. Obviously, we always think that we want to use cannulas for the safety of vascular occlusions. So that is always like the first reason on our mind, that is the first reason we don't want any complications. But that's not the only reason why cannulas can be very good for the lips. Cannulas can be very good for the lips because we can feel muscular parts, we can feel fat pads, whereas with a needle, we cut through everything. And a cannula, because it's a round tip, gives you a lot of feedback. So you actually learn anatomically a little bit more about different tissues in the face or in the lips, because you get that feedback. The other thing with a cannula is you can be very precise with your injection because you can move your cannula until you are in the perfect level above or below the muscle or in the fat pad. Whereas with a needle, the more we move a needle, the more we bruise the patient. And we know they don't really like bruising. And the other aspect that I will also discuss, especially when we look at how we do it with a cannula, is the anatomic and artistic proportions, because you can really evaluate by placing the cannula what you can do with the lips. And this is what I'll try and explain. Then the other benefits, obviously, is the comfort for the patient. And cannulas can be a lot more comfortable than multiple needle injections, faster recovery because there's less bruising with a cannula, and obviously less entry points. The older the patient is, the more beneficial it is because it's more safer, especially if they've got very thin lips. Where I often say sometimes in very thin old lips, the only volumizing part is the labial artery. So then the cannula is even more safe. But especially for the fact that older patients tends to bruise a lot more, and many of them are on anticoagulants or aspirin, and then multiple entry points will lead to a lot of bruising. And as we know, most of aesthetic procedures, especially in women, is done as a secret and not really told to the family or the husbands or spouses. So this will also give you better recovery. So what is all these aspects that I'm talking about? So not just for the aspect of cannula use, but just for overall, for lips, when we do the lips. So in the lips, we need to understand the vascular part of it. And the risk of vascular occlusion is really very important. That's our most feared complication. Then we need to understand the muscular aspects that contribute to a beautiful lip and to good proportions. And then obviously we have the fat pads, and we have to be in specific fat pads. And I've added here, remember that in very thin or very older lips, there's not much of a fat pad, and we have to keep it in mind because in those patients, we are often in the wrong level. We are either intramuscular or very close to the artery. And then we have to take in consideration a lot of different anatomic and artistic proportions. The first most important is from anterior view. So that's when we look at the patient and we look at how the lips actually fit the patient's face and how we can alter it. And then very important from the lateral view. And this is where we see a lot of differences, especially with different ethnicities. And then there's some aspects of the lip itself, the natural structures of the lips. So I'll take you through each one of these. So first of all, the vascular. We know that the artery is like a dolphin going through the lip. So it can actually be in many different places. But this is a publication that was done on almost 200 cadavers, looking at where is the most common area for the inferior labial artery. So this is the lower lip. And we can see most commonly in the submucosal plane, but some of them can be intramuscular and sometimes even subcutaneous, exactly where we are superficially. But also reminding us the closer we get to the wet-dry border, the closer we are to the artery. But just keep in mind that the artery moves through the lip, so it can alter in its position, so we don't always know where the artery is. Then looking at the muscular aspect, because often we do combination treatment with some botulinum toxin. So we have the orbicularis oris muscle, which is two parts, the superficial part that closes the lips, and then the deep part that I'll show to you now that gives eversion of the lips. And it's quite important to realize where exactly this part lies, because this also alters where we put our fillers. Then we have elevator muscles that elevates the lip. So starting from the midline, we have the levator labis superioris aliquinosi, then the levator labis superioris. Then we have the zygomaticus minor elevating the lateral part of the lip, and the zygomaticus major that elevates the corner of the lip. And then we have the depressor muscles, the DAO most superficially, just underneath it, the DLI, and then the mentalis also affecting a little bit of the movement of the lower lip, but more than also the platysma, which also lowers the corners of the mouth. So those are the muscular aspects, just to remind. When we do specifically lip fillers, we have to understand a little bit about the orbicularis oris muscle. So as we can see on this illustration, from the Anatomy for Sculptures image, we can see the orbicularis oris muscle. It has got this hockey stick appearance that we talk about, especially in young patients. It everts the lip. And this is quite important because if you're in the wrong plane with your fillers, you can actually push the lips forward, or you can actually actually push it inwards instead of everting. Important that you realize how it lies, and then also what happens with aging. In a young patient, it's still got a very strong eversion effect that lifts out the red lip, and the older the patients become, the more the muscle weakens, and the muscle actually then weakens, and we get more of an inversion of the lip and a lengthening of the white top lip. So it's important to realize where we want to be with the fillers to have a good effect on the lips. And I'll explain it to you when we get to the procedure itself. Then the other important aspects that I mentioned, the fourth aspect, is the artistic and the proportions of the lip. So if we look at the patients from a front view, and we see different tubercles. On the top lip, 3 tubercles, and the lower lip, 2 tubercles. And that's due to the embryonic origin of how the lips are formed. And we have to respect these tubercles because we can't just fill up the lips all over so it looks like a blown up tube and looks very unnatural. We have to respect these tubercles. The other important part is to look at the vermilion border, the Cupid's peak and the Cupid's bow, and then whether there's filtral columns that are visible or not visible that makes the lips kind of part of it. So those are the important things. So also from an anterior view, we look at the proportion of upper lip to lower lip ratio. And there's a slight difference between Caucasian, African, Chinese, and Koreans, with African, Chinese, the Asians tending more to a 1-to-1 ratio. But we know nowadays the young girls, even Caucasian, like a 1-to-1 ratio. So, but the natural Caucasian or European descent lips is a 1-to-1.6 ratio. So another aspect to take in consideration, this has got more to do with where exactly we're going to put our filler to have a specific effect, is to divide the lip up into 3 different parts: the vermilion border, the subvermilion border, which gives a roundness to the lip, and the peristomal or the wet-dry border, which gives support to evert the lip. And this is where I'm going to talk about where we put it with fillers that